Testicular trauma is relatively uncommon. In the United States, testicular trauma accounts for less than 1% of trauma cases in emergency departments. In this video, we will talk about this disease, testicular trauma, by answering these questions. What is testicular trauma? What are the types of testicular trauma? What causes testicular trauma? Symptoms of testicular trauma. How is it treated? What is testicular trauma? Testicular trauma is when a testicle is hurt by force. Trauma to the testicle or scrotum can harm any of its contents. When the testicle's tough cover is torn or shattered, blood leaks from the wound. This pool of blood stretches the scrotum until it's tense, and can lead to infection. There are several types of testicular trauma, including rupture or fracture. An injury can rupture or tear the tough, protective covering surrounding the testicle and damage the testicle. This is called a testicular rupture or fracture. Contusion. When an accident injures blood vessels in the testicle, it can cause a contusion, which may involve swelling, bleeding and bruising. Torsion. A tube called the spermatic cord contains blood vessels that lead from the abdomen to the testicle. A scrotum injury can cause this cord to twist, which is called torsion. Torsion can also happen spontaneously, without an injury. Hematosal. These can occur when blood collects under a layer of the protective covering around the testicle. Dislocation. Some accidents can push the testicle out of the scrotum. It may end up in the abdomen, near the pubic bone over the penis, or other areas near the scrotum. This most often happens in motorcycle crashes, when the testicles collide with the gas tank. Epididymitis. Testicular trauma can injure the epididymis, leaving it inflamed or infected. The epididymis is a coiled tube that holds sperm for a while after they leave the testicle. Infections. Animal bites can also cause infections in the scrotum. Degloving. In this type of injury, the scrotum is torn away, like removing a glove from a hand. What causes testicular trauma? Many types of events can cause testicular trauma, including penetration by weapons like knives or bullets, blunt force, such as kicks or punches, or things that you can throw, like baseballs, automobile, motorcycle or bicycle accidents, machinery accidents, bites from animals. These type of events can cause minor injuries, like scraped skin, or major problems, like tearing the protective covering over the testicles and causing blood to pool. Symptoms of testicular trauma. The first sign of trauma to the testicle or scrotum is most often severe pain. Pain around the testicle may also be due to infection or swelling of the epididymis. Men who suffer more than a minor injury to the scrotum should seek care by a urologist. Reasons to seek medical care are any penetrating injury to the scrotum, bruising or swelling of the scrotum, trouble peeing or blood in the urine, fevers after testicular injury. Depending on how seriously you're injured, you may be able to treat testicular injuries on your own. However, severe testicular trauma requires treatment from a surgeon or other specialist. Treatments for some types of testicular trauma include placing an ice pack against your scrotum, resting and avoiding strenuous activity, medication to treat pain and inflammation, antibiotics to prevent or treat infection, wearing a jockstrap to support your testicle. In the case of torsion, treatment involves a doctor turning the testicle back to its proper place by rotating it while holding the scrotum. However, surgery is typically needed, even if the testicle has been turned back into place. If the accident has dislocated your testicle, a doctor may be able to press it back into position. Surgery may be needed. Thank you for listening to all the information we want to introduce to you in this video. Do not forget to like, share and subscribe for the HeInfo channel.